Ladies and gentlemen, greetings for the day. Here today I am going to address the topic compulsive shopping, online and offline. Compulsive shopping, often referred as compulsive buying disorder, was first described by the German psychiatrist Emil Kraepelin almost a century ago. He called this disorder as oniomania. Bleuler in the year 1924 concluded that compulsive buying disorder is a form of reactive impulse, and he grouped it with kleptomania and pyromania. But still the classification remains elusive. Investigators have debated its potential relationship to mood, substance use, obsessive compulsive and impulse control disorders. DSM included compulsive shopping to the category of addiction and related behavior. Compulsive shopping is classified by ICD as impulse control disorder, not otherwise classified. This behavior has since been referred to variously as compulsive shopping, compulsive consumption, compulsive buying, addictive buying, uncontrolled buying, and spandaholism. In the definition, compulsive shopping is a mental health condition characterized by the persistent, elusive, excessive, impulsive, and uncontrollable purchase of products in spite of severe psychological, social, occupational, and financial consequences. There is a difference between an ordinary non-addictive consumer and a compulsive buyer. An ordinary non-addicted consumer, they give importance to the usefulness as their primary motive for shopping. Compulsive buyers make purchase in order to improve their mood, to cope with stress, and to gain social approval. There are 4 stages of compulsive buying have been identified, that is anticipation, preparation, shopping, and spending. In the first phase, the person develops thoughts, urges, or preoccupation with either having a specific item or with the act of shopping. In the second phase, the person prepares for shopping and spending. This can include decision on when and where to go and how to dress and even which credit card to use. The third phase involves the actual shopping experiences, in which the individual may experience intense excitement and even sexual feeling. Finally, the act is completed with the purchase, often followed by a sense of letdown or disappointment with oneself. Compulsive buying disorder is found throughout the world, although it appeared to be confined to the high-income countries. A recent random sample survey conducted in US reported that prevalence rate of 5.8%. High prevalence rate is found in female. However, prevalence estimation in epidemiological research varying, and it ranges from 1 to 30% depending on type of sample studied. The age at which compulsive buying has started has been reported in the range from 18 to 30 years. Many literature review also has suggested that this disorder runs in families along with the high incidence of mood, anxiety, and the substance use disorder. Coming to the clinical features, there is frequent preoccupation of shopping and the buying, and this happens even they recognize that it is causing their problem in or negative impact in their life. In this process of shopping and buying, they develop various kinds of satisfaction of moods. Most buyers, they purchase goods that are of little or no use. They often feel a release of tension after the act, but just before buying, most individuals they experience sadness and loneliness. Compulsive shoppers often suffer from poor self-esteem and marked distress, and commonly they have comorbid conditions like anxiety disorder, OCD, binge eating disorder, etc. In a recent study conducted in US, among the compulsive buying participants revealed that 44% of them they normally felt good after purchasing, 52% they like to have something new always, 17% they like the sense of power or autonomy, 24% they felt that they are being distracted from other problems while they are shopping, 46% they felt that afternoon was the most common time for shopping. The same study also have reported that just before buying, most individuals they experiences sadness and loneliness, although few reported happiness and elation. The most commonly purchased items were clothes, shoes, jewelry, etc. In the etiological issues, neurobiology, there is an imbalance between an overstimulated drive state and the impairment in inhibition and the reward processing. There is also probability of impairment in the frontal inhibition due to the dysfunction in the serotonin system. Also owing to the alteration in dopaminergic system which influence rewarding and reinforcing behavior, there is exaggerated craving and the urge state has been observed. Few sociocultural factors has been identified that is linked to the compulsive buying, like easy availability of the credit cards, then increased media advertisement, then opportunities for home shopping through television shows and internet. In the psychoanalytical theory, deep-rooted conflicts, early life events, or absence of stable internal self-image have all been reported as or proposed as contributory factors in compulsive buying. The negative emotion associated with early events are dissipated by euphoria while buying, but this is of short-lived, it doesn't last longer. In the cognitive behavior theories, antecedent factors has been identified like early developmental experiences and family environment. There are internal emotional states has been identified like depression, anxiety, and external triggers like advertisement, credit cards also has been identified. Then the actual act of buying happens. However, when they get this purchase home, they are flooded with emotions of guilt, shame, and regret. Next, in the management process, appropriate management of compulsive shopping has not been established as there is limited evidence of what exactly works. But there is a scope for both pharmacological and psychological treatment. There are case studies reported that response to antidepressants are positive. There is also similarities between compulsive shopping and OCD. It demonstrates that medications that is used to treat OCD would also be helpful in the treatment of compulsive shopping. However, studies showed mixed results. In a 12-week trial of citalopram reported that 15 out of 24 participants they responded positively. A more recent study found that escitalopram was no more effective. Fluvoxamine also showed mixed results, but naltrexone is reported to reduce urges to shop and the compulsive shopping behavior. In the psychological intervention, cognitive behavior therapy, cue exposure, self-help program combining cognitive behavior strategies with the self-monitorings are helpful. In the nursing interventions for compulsive shopping, initially there is a need to collect the detailed history and MSE. Special attention should be given to assess the coping skills and the problem-solving skills of the client. There is a need to help the client to accept his or her behavior. That is very important. Then involvement of family members in the treatment process is very, very important. Help the family members to understand the disease condition so that their full cooperation can be achieved throughout the treatment process. The alternate coping strategies that can be used, like distancing oneself or engaging themselves in other productive activities, should be explored and discussed with the clients, and suggestions can be provided accordingly. Then limit setting and a verbal contract between nurse and the client can also be helpful in this management. Exploring hobbies is another important step to make them engage in different activities. Positive reinforcement should be given to them for any kind of small effort that the client is displaying. And a relaxation skill training is also important. It will help them to reduce the anxiety. Few tips can be provided to the family members and the client to reduce the compulsive shopping, like make a list before going to a store. Ask the family members to accompany to the client to the store so that they can give a reminder. Cut up the easy accessibility of the credit cards as well as watching teleshopping channels, and make them involved in other activities and distracting them to other activities in home. At the conclusion, compulsive shopping can adversely affect the individual and the family, social and the occupational life, and early identification and appropriate management can improve the outcome. Thank you very much.